I've veined horses, I've food horses,
I don't see horses, yeah.
I've
if anybody has a complaint, it's Ellen.
packed chickens, I got pigs,
Because you actually do the job of the people that you have to go hang out with though. So all right. So
You're right off on my house. My life, Mom.
what's that?
You're right off on my house.
I have lots of patient contact with the cow.
So Amber wants to use a cow C-section for how many hours you want for this, Amber? She just wants one.
Did you tell Hater, did you insert your arm through her rectum and?
Do we allow that for 1 hour for her cow C-section?
You can do all kinds of things.
Rebecca and Amelia aren't even listening to you. Like they admitted, Amelia's playing FIFA soccer. And Rebecca's chasing kids or something.
I'm listening.
Yeah, I'm listening too. We haven't been on the call long enough for me to not be listening yet.
What? Do what? All right. We're live. Don't talk about it. I don't. We're live, so don't talk bad about people. No, you're not supposed to talk about anything. You want to take contact. So, all right. So, chapter 21, poisoning and overdose emergency. We'll kind of go through the chapter. I'll look for things because it's taken forever for the chapters to download. I thought I had 21, but I guess not. And our internet is super slow. And so I'll just go through this chapter, kind of hit some high points with the key terms and things like that. So, poison is any substance that can harm the body by altering cell structure or function. A toxin is a poison substance secreted by bacteria, plants, or animals. So Amber's friends, the bees, whenever they sting you, you get a toxin. Also, it could be like poison ivy or things like that. Whenever I heard that we're going over poison, one of the first things I did, I started naming off the different ways that you could come in contact with poison. And so, ingested, it's completely obvious, right? What an ingested. So, poisons that are swallowed. Inhaled, poisons that are breathed in. And this could be anything from an incidental, a mouse spraying my crops and got overcome, wind changed direction or whatever, got overcome, to somebody huffing drugs or huffing paint. And so that would be a couple examples of inhaled toxins. Absorb poisons that are taken into the body through unbroken skin. An example of absorption is you've heard us talk about the nitro paste. And that's how that works. You just put it on the skin absorbs through the skin is semi-permeable, and it allows the absorption of poison. Injected poisons. This is anything that isn't injected. So we're talking about like needles. There's the definition. Poisons that are injected through the skin, for example, by needles, snake fangs, or insect stingers. So, you having trouble breathing today?
Hey, we got to take some contact.
There you go. You guys should go get the monitor and hook her up and see what her pulse oximetry and her waveform capnography are.
My pulse ox, I promise you, will be normal.
But will your
It usually does whenever I'm wheezing. It may feel like I can't get air.
But does your waveform capnography, which is better than the pulse ox. So, anyway, moving on. So, I think you guys should do an assessment. That's just me. So looking through the patient assessment of ingested poisons, what substance was involved? When did the exposure occur? These are just some questions that you should ask during the patient assessment phase. How much was ingested? Over how long a period did the ingestion occur? What intervention has the patient, family, or well-meaning bystander taken? Guys, believe it or not, sometimes those interventions they take make the whole situation worse. Thanks, but no thanks, people. What is the patient's estimated weight, and what effects is the patient experiencing from the injection? Anybody got an idea what a good idea, or what a lot of hospital doctors will do with ingestions and poisonings and toxins? Well, let's say that a kid drinks a chemical. What are a lot of them going to do? Yeah, a lot of them will call poison control. They'll see what treatments, because poison control has all the treatments that you could do. There's nothing that says you guys can't call poison control. All right. You should, yes, you should call poison control. Does it say to call poison control in the book?
It says call poison control.
It gives you a number. I actually
Or call medical directions, they'll call poison control and they'll tell you.
I put the poison control sticker on my coffee mug because I am just certain that somebody's going to try to poison me, and so I need that number so I could call poison control. Anyway. Food poisoning typically caused by a bacteria from improperly handled food. A lot of food poisoning happens. Does it say like the time onset or anything? Did they want you guys to know that? I'm looking. I don't see anything. Yeah. Diarrhea, nausea, vomiting. Yeah, it can't. And it could last up to, is it up to 24 hours? Didn't have a match. And it does, and I guess it all depends on what kind of poisoning.
Like salmonella.
Yeah, salmonella knocks for a loop. So, if another example of food poisoning, or I guess it's not really food, but if you drink bad water and get, yeah. Think you're in Mexico?
Oh yeah, you don't drink it.
So, all right. So, for a lot of your, let me make sure I'm giving you the right term here. A lot of your ingested poisons, you guys do have on your ambulance there is activated charcoal. It does give you some examples of when not to use activated charcoal. So there are, however, a few instances you should know about where the use of activated charcoal is contraindicated, which is patients who cannot swallow, obviously cannot swallow activated charcoal. That's a given, right? We'll talk about protecting your airway. You can't give people things by mouth that can't protect their airway. Patients with altered mental status that might choke on activated charcoal and aspirate it into the lungs. Patients who have ingested acids or alkali should not take activated charcoal because this caustic material may have severely damaged the mouth, throat, and esophagus. Activated charcoal cannot help the damage that has already been done, and swallowing it may cause further damage. Examples of such caustic substances are oven cleaners, drain cleaners, toilet bowl cleaners, and lye. Do you guys? This is kind of off the subject. Do you guys know how to tell for a real basic, not a real basic, a semi-neutral basic chemical, to whether it's basic or acidic? It's a basic or alkalotic substance is slippery. So don't go pick up things and rub it. Oh, yeah, that's alkalotic. But an alkalotic, if it's an alkalotic thing, so like bleach is alkalotic.
Yeah, it does kind of find me.
You don't use gloves with bleach?
I didn't believe it. Oven cleaner, I clean my oven without this.
You guys are crazy.
I'd rather do like this. Because I can't breathe on.
You're supposed to have a mask. But anyway, activated charcoal. Patients who have accidentally swallowed while siphoning gasoline cannot be given activated charcoal.
I
Sounds.
swallowed gas.
I don't, but- yeah. Examples of such. Okay, so like they're getting off track here.
What about siphoning gas?
That's probably why Amelia stopped listening and plays FIFA. What's that? Oh yeah.
Okay, tell me what you think about this. Levi told me this today. And I wanted to call and telling you the stupid this. He said that he saw a guy get acid in his eyes. And they sprayed Windex in his eyes. And it
Well, so
seems like Windex would burn just as bad as.
but are they okay? So one, you have to Windex, I believe, is ammonia. Ammonia is alkalotic. So, what's that? So you're neutralizing the acid with the Windex.
I don't know, it seems like it would burn though, just.
Well, but you're typically it burns because everybody thinks that an alkalotic substance doesn't burn. It does burn.
Right, still.
Yeah. And so, yeah, if you spray Windex in your eye, it's going to burn. It's alkalotic. But you have an acid in your eye and you use Windex, you're going to neutralize it. I think water would be a better option, but
I
it
think
was
that's all they had that was close by or something. I
was
don't know.
was this on a rig?
It was out. I don't know where it was
Okay.
at.
Well, because those safety guys usually have procedures and MSDS sheets.
All I know is Levi's a dirt man, so it's probably around the bulldozer somewhere or something.
That wouldn't be my chemical of choice to spray in my eyes. I think a proper flushing of water for 15 to 20 minutes would probably be a better option. That's all you have. But then again, let's say that,
He said he could see, but he didn't lose his eyesight. Like,
yeah, what's that?
pee in his eye.
Stand still, buddy.
I'll let you give another thing.
I'm sorry, but if a guy's hurting bad enough, he's afraid he's gonna go blind, he may do it.
So,
I think you're my eyes now.
It's like there's some acids out of his rig, a big rig, that are
you're talking,
activated more with water.
and you're talking about kind of a powdered acid. Yes. Guys, so since you guys have these really good questions, typically how you're going to clean off these poisons or these acids or alkalines or whatever, if it's a wet type substance, typically what you're going to do is spray it off. If it's a powder substance, you're going to brush it off as best you can and spray water. You have to be real careful on rigs though. Those guys use some nasty chemicals, and they should have the MSDS sheet there, which tell you how to properly treat it. I agree. I wouldn't go just spraying water on any acid or any powder. You need to clean it off. You need to have an idea of what it is before you do it. Even though the typical treatment is douse them with water and lots and lots and lots of water. But yes, there are those chemicals out there that you don't want to do that. Typically, whenever those are being used, the guys that are using them know that. And what are they? It's just called acid, isn't it? Is that what they call it? Caustic acid. Yes, right. Yeah.
But if you think about it though, a powder, to get it to activate, you're gonna have to mix it with something. So what? So then it would not be a good idea to.
Yeah.
I know that's in your eye, you think of it. It's one mixed with water in your eye.
Yeah, you're well, and on that, once again, you want to consult an MSDS on those types of things. You don't want to screw that up. So.
when we told him that in the first year, we're gonna get it back in the original.
Yeah. And typically they still using safety guys, or we down far enough where we're starting to lay off safety guys?
No, safety still do.
Safety
Oh,
bigger
it's not-
than it was before.
OSHA's gonna let that go.
I got offered a safety job,
Yeah, you would want it. That's a big,
$211,000 a year.
that might be all right.
You know, David's biggest thing is a safety guy that comes out and just like every little detail doesn't have to do with something.
Yeah, I agree.
If the safety guy comes out and he will jump in and help, or he'll say, hey, you know, and turn his head. Those are cool.
Yeah.
But the ones that come out there with you, safety guys, and all that stuff, every little thing,
It's a pain in the ass.
they make your job easy.
They're like English people, you can't beat them.
You say you can't believe them? Oh, please them. Oh, okay. Like, believe them? God damn. These guys are liars. But anyway, moving on. What?
We're
So-
just full of questions tonight.
You guys are full of bullshit.
It's
Yeah.
interactive, we're being interactive tonight.
No, actually, all the conversation's been really good.
We're making you
We
feel
don't go
good.
back to not talking.
No, please.
I'm only saying that because we're in a room full of females.
What is next, Professor?
Professor.
Professor Stevens.
Yeah, let's not do that. Moving on. So, you're late, Jimmy. No, notice this isn't your crew anymore. Interruption after interruption. That's your other boss? You work for Jimmy? I didn't know that. I'm sorry.
Jimmy, you should have hired me because I got to get my taxes done. You get in trouble, dude.
All right, so ingested poisons, first take standard precautions. You want to quickly gather information. You don't want to kind of dilly-dally on these things. So call medical direction on scene or en route to a hospital. If directed, administer activated charcoal. You may wish to administer the medication in an opaque cup that has a lid on with a straw. Position the patient for vomiting and save all vomitus and have suction equipment ready. Not all patients will vomit when given out activated charcoal. Or stories of threatening them with tubes in their throat. Most of them after that point will keep it down. Yeah, basics can't tube them, so that's a kind of an empty threat. Yep.
He was gonna be relaxed, really relaxed.
Whenever I was a little kid, I drank, or I didn't drink it. They thought I drank a whole bottle of cough syrup. And, I drank cough syrup. When I did, I pulled the sheets back and dumped it on the bed and covered it up. And so, my mom freaked out and she found on the bottom. They're like, you got to keep him awake, for blah, blah, blah. And I think we're getting close to a time where she had to stop watching. She had to put him in the bed and pull the sheets back, and there's all the cough syrup. I imagine. Now, if it was my sister, I'd tell you no, she didn't get it with him. So, dilution, thinning down, or weakening by mixing with something else. Ingested poisons are sometimes diluted by drinking water or milk. But please call poison control before you do something like that. Matter of fact, before I would give a patient water or milk, I may even call the receiving hospital and say, "Hey, this is Rob. We had a patient that drank a whole bunch of beer, not really, and called poison control. They said to give them a cup of milk. Are you okay if you give them a cup of milk?" They're probably going to say yes, but that way the doctor is involved in that decision making rather than you just giving them milk, because there may be something else that they're going to do that they have in mind that might work, and maybe they dealt with it before, and it's better to do water or whatever. Something that I want you guys to get over the fear of is talking to physicians. A lot of EMTs have a fear of calling up their medical director. They have a fear of calling up their medical director or the receiving hospital and talking to the physician. The physician typically is a good person to call and consult with. They can give you good advice. And guys, we're working under a doctor's license. So if you're not sure about something, it's always good to call and talk to them. Our medical director here is super cool. Call Dr. Eubanks and talk to him about, whatever, and he'll tell you what he wants you to do. You may run into the occasional jerk in the ER that just is a bear to work with. You know what? Just write it off as that guy's a dick and move on. Don't not call a doctor next time. You need to gather that confidence to be able to talk to doctors. Yeah. Thanks, Dick. Hang up. Did you call me a dick? No, I said doctor. I must have hung up too quick. So, antidote is a substance that will neutralize the poison or its effects. So, poison that you guys, I fear that you guys will see in your career is heroin. I saw a map the other day of the opiate epidemic in the United States. Oh my gosh! Yeah. So here's the issue. So, well, no. Here's the issue. Not you guys have this closed Western Oklahoma view. We are a bad map.
Oh yeah.
But you get away from Oklahoma and you get to some big cities, Dallas. You get to the east and west coast, and you're having an emergent heroin epidemic. Oh yeah. No, big time. What's happened is we have prescribed all these opiate pain medications to these patients. Need it or not, we continue to give it to them. They're addicted. That's plain and simple. They're addicted. Nothing against the person that's addicted. It happens. These things are highly addictive. It could be something as simple as you had a C-section, had some given some pain medication, and now you still have this pain, so you take it. A lot of times, what it is it's withdrawal pain. Well, they keep treating it. It's just we went through a period in the medical field where you had to treat pain. The patient could sue you if you didn't treat pain. And so we developed a huge opiate addiction in the U.S. Well, now what are they doing? Well, they're cutting down. They're limiting how much fentanyl and how much opiates to be made. They're making it so. What is it? A 2 week or a month prescription now? But it's a very short period of time. And you have to get a new script every time. There's not refills on it. And as a matter of fact, they're starting to crack down even on being able to administer it. A lot of these doctors get scared. They're not even writing for C2s or opiate-type medication anymore. Here's some ibuprofen. Now you have an addict that don't have a fix. Well, do you guys know what heroin is? It's just an opiate. Heroin could be cleaned and be used just like morphine or anything else. As a matter of fact, heroin, when it's metabolized in the liver, becomes morphine. So now we need a fix. We are bad hooked, and that dude over there told me, has a hookup, has the heroin, and now we start doing heroin. So now we have a street drug problem. And so that's what you're seeing. You're seeing an opiate epidemic, but also a reemergent of heroin. Whenever we went, yeah, no, they should call the ambulance. We have fentanyl. I'm very selective on my fentanyl. So I gave fentanyl to the oldest patient ever the other day, 101 years old, and I gave fentanyl to her. So, you know what? You probably deserve it at that point in time. And if you get addicted, so weird.
Yeah.
Melting them down and injecting them.
People that have problems,
So going back to the poison, the antidote, where this all started. You guys as EMTs are able to use an antidote called Narcan, or now I'm looking at it, I didn't realize we had it on the face, Noxolone. And basically, what Narcan does is compete with the opiate receptors in your body, because your body's has opiate receptors. And so it binds to these receptors. And now the opiate's not able to bind to the receptors, so you don't get the high, it blocks the high, brings them out, they come back around. And like I've told you guys before, sometimes they're very violent. They want to fight you, sometimes they throw up. And they're very confused. And so part of pushing Narcan is push it slow. I would definitely read about its administration there. You have 8 steps to administration. I'd probably get to know Narcan if I was you guys. As a matter of fact, there's another drug back here, activated charcoal. I would probably read the activated charcoal and the Narcan thing. I did talk to some EMTs tonight that just recently went through, and I'll talk to them a little bit more on the testing questions. But they said that you guys will need to know the 5 patient rights whenever administering medication. So basically, on all these poisons, you want to know what substance was involved, when did the exposure occur, over how long a period of time did it occur, what interventions has anyone taken, and what effects is the patient experiencing exposure. They say that over and over again. Don't forget the weight. Gotcha. And that patient weight thing is on. The patient weight thing is on every single chart. You need a patient weight. So, acetaminophen poisoning, not a fun way to die. Don't do it. Slow and painful. I don't know. Well, I think what it is an attention thing. They don't realize that this could really hurt them just over the counter. They think they're just going to do it for attention. They could get their stomach pumped and everything will be fine, but it's not. Women don't typically bite the bullet.
Women don't bite the bullet unless they want to look at it in their bottle.
No, it's true. Some of them, I'm trying to think if I've ever had a woman. Yes, I have. Woman suicide by gunshot to the head. I have. Here. No, eyeball and windowsill was a man in Weatherford. So.
My aunt, she thought she wanted to kill herself. She went out to this abandoned farmhouse. She doused herself with gasoline. Caught herself on fire, and then she figured out she wanted to kill herself.
Not that way.
And a farmer just happened to be driving by. We put her out, she's still alive, but she was melted. She kind of died, but I'm like, you don't burn yourself of all things?
Uh,
I hurt.
there's a guy in Oklahoma City, Midwest City actually, who went to the gas station that his girlfriend or ex-girlfriend worked at, turned on the pump, doused himself with gas, and lit himself on fire. Anyway, moving on. Let's get through this chapter. So carbon monoxide poisoning, typically, whenever you find carbon monoxide poisoning, maybe it's a house fire, maybe they attempt suicide, shut the car door, or maybe they didn't even think about it, but they're running a car or a small engine in a confined space. You might see that somebody using a pump in like a basement to evacuate the basement out. They get down there, they're working, they don't think about it. Next thing you know, they have CO poisoning. Sometimes you have it with like hot water heaters that go out, pilot light goes out. All kinds of different reasons why you might end up with CO poisoning. But some of the signs and symptoms are headache, especially a band around the head, dizziness, difficulty breathing, nausea, cyanosis, and altered mental status in severe cases. Unconsciousness may result. If you come across somebody and they have that cherry red hot skin, it's a CO poison. It's big. That's how they die.
I think that was right there, not too long ago. Now that my fingers, the coffee being my one was different.
And not only oxygen, that's what we're going to do for them, giving them oxygen. But most of the time they need to go to a hyperbaric chamber because they have to disassociate that the CO from the hemoglobin, and so that they can then take in the oxygen.
Just to say in the book, just because I remember reading it, it says not typically the cherry red skin, it's the cherry red yes.
Okay, the cherry red skin comes, they're dead. If you find a dead person that's like that. So.
If their lips are red, they're dead?
No.
Oh, I was like.
Yeah, no. If you come to somebody and they're cherry, it's a very grotesque, obvious sight. That cherry red. But no, that's a death. All right. I think CO, they're talking about smoke inhalation or just smoke inhalation here. Oh man, they talk about detergent suicides too. Be careful on cars. Guys, I'm going to be honest with you. We don't have any detergent suicide around here. Have you guys heard of a detergent suicide around here? That's typically a coastal thing, a big city thing. Is it Japan too?
Oh, where they're big, yeah, that's weird.
What's that? Oh, I know, right? Yeah, that's a synthetic marijuana or K2. Yeah, did you guys?
But he can do subtraction in his head and answer your questions.
He had a blood clot from a simple procedure.
Still, it's in the series.
Are they gonna go in and get it, or?
It doesn't say. It's having neck surgery.
Yeah. What's that?
It's like he's having neck surgery now. They're not even for blood clot.
Yeah, I feel bad.
I like DJ too.
I like him, but man, he gave me a ticket.
He don't give me 3 strikes.
I've only got 9 months to work this.
Such bullshit.
He gives me 3 chances. On the 3rd chance, he gives me a ticket.
The first time he pulled me over, he gave me a ticket. I was going 86. Yeah, 65. I wasn't paying attention. I was in the Land Cruiser and that thing rode so smooth, wasn't paying attention. And I think I was talking to my mom on the phone. And way up there, I see him pop the hill. And I looked down and hit my brake. He flipped around. All the other guys, let me go.
Yeah, there is a new guy in town that comes through so often that is.
Oh, really?
Yeah.
I got Micah Whittington hit me at 101 mile an hour going to Leedy. how. I knew I speed, and I was like, I just going to jail. I knew I was
How
going to
could
jail.
you not know?
When you're doing 100.
And I just knew he wasn't going to let me. Yeah, he's going to take me to jail. And he's like, "Where you headed?" "Where you teach class?" He said, "Take your driver's license?" "Yeah." I gave it to him, and I said, "I was gun on me." And so here's my concealed carry and everything. Well, you can slow down a little bit.
Yeah, I never turned my concealed carry to stop.
You're supposed to. Last thing I need is for them to beat me up and shoot me. But anyway, moving on. Blah, 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 core concepts, read the chapter. Poison control centers are a good source. Here's absorbed poison. So remove patient from the source of the source or the source from the patient. Avoid contaminating yourself with the poison. Brush powder from the skin from the patient. Be careful not to abrade the patient's skin. So don't like rub it real hard and cause abrasion. Remove contaminated clothing and other articles. Irrigate with clear water for at least 20 minutes. Contact medical direction and transport the patient. I'm going to tell you this. That's great for this textbook and stuff. But guys, we work out here in Western Oklahoma on the rigs. Get the MSDS, call poison control, make sure that you're treating it properly because there's so many different kinds of poisons out here. You guys had a good point. The fuel pusher and the company man should be there. Sometimes the safety guy might be there to be able to help you along. They know what to do. They know the chemical they're working with. Most of those guys know you don't put water on caustic soda. Alcohol and substance abuse. Don't drink too much. Patient assessment, alcohol abuse, odor of alcohol in the patient's breath or clothing by itself. However, this is not enough to conclude alcohol abuse. Be certain that the odor is not acetone breath, as with some diabetic emergencies. Swaying and unsteadiness of movement, slurred speech, rambling through patterns, incoherent words or phrases. Okay, so we're all big kids. We all seen drunk people, right? What you should do is one, don't be judgmental because it's probably going to be me. It's fine. Don't judge, right? The other side of that is check everything. Just because you're pretty sure they're drunk, make sure their blood sugar's in check. Make sure that make sure they're not having a diabetic emergency. Okay. So there's some alcohol is actually a very dangerous drug for people who quit cold turkey. The alcoholics, they go into DTs, go into seizures, and they can die. We're sitting talking about all these hard drugs like heroin and stuff. That's just not very much fun to quit. But something like alcohol can actually kill you for trying to quit. And that's why they need to go to treatment centers typically to get through their DTs and stuff. So. Trying to just read through here. I had a guy one time, and we go into his apartment. It's all dark and everything on the floor, and he's going into DTs, and he's talking to him. I said, "What's going on, man?" He said, "So I've been on the bench for a while. I was on the bench for a while, and a couple days ago, I decided to quit drinking. Now I'm on DTs anyway." He's been there, he's done that. And I said, he picked the wrong day to stop drinking. And we're just joking around with him, and so it's talking, and so his feet had all this stuff all over it. And it looked like blood. I thought, well, he cut himself somehow. So we're loading him up into a stair chair. He was like on the second or third floor of the apartment. And I said, "Man, how'd you touch your foot?" He goes, "That ain't blood. It's shit all over myself." And so, yeah, it's disgusting. And so anyway, I made my partner do the foot part of the stair chair. So that's an advantage of being. That's one of the only advantages of being a paramedic. So you're like, no, I'm not. I got head, man. You got feet. Shit's gross. Substance abuse. You know, yeah, he was. He was super cool. I treated him. I mean, you know, usually got a feel for some people you can joke around with, and some people you can't. But he was. I think he joked around with us a little bit too. So that's how you know. Yeah, and it's so we're kind of razzing each other a little bit. But yeah, he's having a hard time. So. Substance abuse. Talking about uppers, the stimulants such as amphetamines that affect the central nervous system to excite the user. Downers, depressants such as barbiturates. You guys might see some benzos, like Valium and things like that. Narcotics, a class of drugs that affects the nervous system and changes many normal body activities. Their legal use is for the relief of pain. Illicit use is produced intense state of relaxation. I'm telling you, look at the map. It's just a matter of time before we're dealing with a large-scale opiate type or a narcotic type thing. Matter of fact, state of Oklahoma has recognized it. That's why we have the nasal Narcan protocols in Oklahoma. That's why they actually did a program where if you didn't have the money to get it, they'd buy the Narcan and nasal atomizers for your surgery because it's common. Hallucinogens, mind-affecting or mind-altering drugs that act on the central nervous system to produce excitement and distortion of perception. A lot of you guys know things like LSD, acid, and mushrooms. Mushrooms are pretty cool.
Mushrooms are not cool. Don't even say they're cool.
They are cool.
No, they're not. For your time in the full board of the deep. And you just keep over the point.
Mushrooms are cool when you can't control your drugs. I've never gotten high on mushrooms.
Don't do it.
What? You're scared of ecstasy and you're like asking. Hey, gosh, this class just went downhill. That was like 3 weeks ago, Rob. It's all good. I quit. My brother-in-law loved acid.
I did too. I only done it twice, but I had to really move out of that county because I knew if I stayed.
His new thing is mushrooms. He loves mushrooms now. They go to these festivals and do mushrooms, and I don't know. I know the shrooms. So the deal is kind of like what Amber's talking about, and what we're talking about here is all these hallucinogens and things like that are going to affect people differently. I was with a girl one night that had a bad trip on acid, and her friends were giving me a ride home. I didn't have a ride home from this concert. It was in Wichita and I was in Pratt, and she's tripping on acid, and she's so scared this graveyard's coming. I'm like, you're crazy. But she's scared the graveyard was coming to get her. Oh, it's right there. But, no, it ain't right there. So.
Oh, that's a good thing to be doing on acid.
Down 412.
You went hunting down 412? Oh.
Drugs are bad.
Drugs are bad.
I went to Black Hole. I later found out it.
So volatile chemicals. If you run on like in areas of a high Native American population, you can run a lot of huffing. And if it's a bad huffer, they'll huff anything and everything. I had one that we ran all the time for stupid things. They coded him once for huffing brake cleaner, and they got him back. And they found some malathion, which is I think the nerve agent or organophosphate. And anyway, they found it when they were cleaning up this thing for like Thanksgiving or something. He's down there, and he just decides to huff it. Finds this brown jar of chemical out in the forest, and he huffs it. And he died. And we're coding him. Man, that ambulance was bad. They had to shut down the Clinton ER because of it. But
What about the kids doing that compressed air?
Well, the compressed air might be a new thing, but the other one that they did a lot with is called Whippets with whipped cream. So basically, you don't shake the whipped cream up, and you just take the air, and it's supposedly like laughing gas, nitrous oxide is a propellant supposedly. You
the compressed air was killing people.
Wasn't there a kid that died from trying to get the coolant, not the coolant, but the Freon over out of
ACU behind the library.
Yeah, behind the library over at Elk City. So, yeah, yeah. No, and gold tends to be one of their favorite colors, and it's always funny whenever you go run on somebody calls, and you get there, and they have gold paint all over their face, and you're like, "You been huffing?" No. Okay. So.
Why gold?
I don't know. I don't know if there's a difference in. I don't know if they could get the gas out better, but gold was always a favorite color. So read through this chapter. I did a terrible job of going over it. I think. Sounds like I have an experienced crew of the last half of it. I'm not judging Amber. I'm not judging, I promise. Chapter 22, abdominal emergency. Let me see where we're at on downloading our PowerPoint slides. 22 is? Okay. I was trying to see where we were on the downloading station. Okay, yeah, go get a smoke real quick.
Hey, on Thursday?
Uh-huh.
I'm going to leave class early, about 8.
Okay.
I'm going to miss one of my kids' baseball games so I can make it to the second one.
That's cool.
In Elk City. So, I think he plays at 7:30 and 8:30.
Take a 10-minute break, TV Land.
Get off Monday morning, so you can go home and get dinner ready for school, take care. And that's what working in house is. First day this week.
We start every Thursday. Yeah, so we play every Thursday, so I might have to leave early a couple times.
Okay, 21 is next Tuesday.
22 is not until next Tuesday?
21 is next Tuesday, 22 is next, or is not due until the 8th.
Okay, so we're going to get.
saw Diane Tuesday, and she posted it to me. She asked me if I didn't have any issues, and I just got really having to give myself right before she started listening to me. I was kind of expecting to hear something. I normally am.
Rhonda mad at me today.
Swear that woman. I told her, I was like, what the hell are you doing? Taking a day part or something. She was like, or she just kept going and kept going. I was like, that is a touchy subject. Why the hell would you open your mouth and insert your foot?
Well, it's one of them things that's, you know,
There's a lot of shit that you doesn't understand though, I say.
well,
No matter how much you dumb it down.
I explained it in our meeting, what was going on. You know, the thing about it is we haven't missed that many transfers. Like I told her, Rhonda, probably in the 7 or 8 years I've been here, we might have missed 6 transfers. Really? Really? And
But she works over in the hospital, and so she knows.
well, it's something that she needs to mind her own business about. And
That's the problem. She hated it.
it's not her department. It's not something she needs to worry herself about. The other side of it is
Yeah.
it's an impossible thing for me to solve until somebody like Cindy decides that it needs to be solved. I can't solve. I've tried telling them how to do it. This is how you guys need to do this. Nobody will listen to me.
Yeah, and it's a matter of, it's not, I mean, it's everybody else. It's not so much you not wanting to do it, it's everybody else that needs to be cooperative with it, and
Yeah, no, everybody thinks that I should just be able to get people to go on transfers whenever I say. I can't.
it doesn't work that way.
I can't
It
send
doesn't work that way in the big cities either. I mean, it doesn't work that way, period. I mean,
Well, then I said, can you just call up your employees and tell them to come in and do something on their day off? No, you can't. So you call them and ask them.
yeah.
I just thought if you doubled that money like you did, that it would, you know what? I said, Rhonda, you see there's a problem? I said, you know that I'm having an EMT class. Why aren't you out there? Well, I got rental properties. I don't need to do that.
Yeah, she turned around and she told me, she said, I don't know how you do it. I don't question it. I just do it. But yeah, I know. I'm a single mom. I have 3 kids at home. Work a full-time job working for her. Plus, this past month, been working for Ellen too, and still attending class. I don't analyze it. I don't question it. I just go where I'm supposed to go at the time I'm supposed to be there.
Imagine. Yeah, sometimes people just mind their own business, and that's what that boils down to. It's not something that she needs to go talk about. It's not something that she needs to talk crap about. She's not going to be able
One of
to.
those kids that always ask the question, well, why?
So, I wasn't real happy
Well, I
about
was
it.
like, well, now that you're done with your damn presidential debate out the damn hallway.
I typically just blow it off and go on with my day, but I kind of had enough of people lately.
I tell you're a little bit irritated. He's like, well, I just said something to Regina. I don't know why she wouldn't say anything to him. But because it's a touchy subject.
That's
You don't understand.
big. Yeah.
You got all these rental properties and everything. Marty's bitching about something that you don't have time to sit around and figure out. Well, that's it.
It's like everything when it's outside the school. I used to smoke everywhere.
All right. Abdominal emergencies. I know this is slide 33. We don't want to see what the video is.
Yeah. Yeah, it's a dangerous situation.
All right. Abdominal topics are abdominal anatomy and physiology, abdominal pain or discomfort, abdominal condition, assessment and care of abdominal pain or discomfort. Oh, hey, shut that light off above me. Please. And so you guys have the slides here.
Oh, we got slides for 21?
Yeah.
22?
I found
There's
them.
Neil.
I know. I was kind of embarrassed because I was doing this when my girls was there and I flipped to that page. I was like, come on.
Yeah.
I don't think I should be looking at that.
What were you looking at?
So,
You'll see it. And not animated, like real live.
so
Wait.
this,
Oh, my girls see, well, maybe they do need to see that. They'll be like, no, I'm just scared I don't want that. This is what all people see. See how nasty they are?
Rob did discuss it with us.
All girls, boys are gross, they're disgusting.
Oh, we were talking about drug addicts and sex.
is Amber telling you about it?
She said she was boring. She was a sex addict. And we said, just imagine if you were on meth or something, and it would have been a bad situation for old Rory.
Yeah.
She'd either want it all the time.
Yeah, it's legal.
You must have all
So, all right. Order in the classroom. So, visceral pain originates from the organs within the abdomen. Fewer nerve endings allow for only diffuse sensations of pain, frequently described as dull or achy. What? 22?
We skipped.
need to go
Did we miss the anatomy and physiology? Or they may be after? Sometimes they get mixed
Visceral
up.
peritoneum.
So on
Yeah,
one
I
of those,
don't know how they skip.
Peritoneum.
I don't remember if it was the chapter test for
Peritoneum.
19
Just a-
or 20.
We talked about the peritoneum.
I just was trying to skip to the end.
Okay. Yeah, but
I was already at 14.
on one of those-
Small, this is 64 slides.
On one of those chapter tests, it was either 19 or 20. I don't know. But it was a question about rectal oral glucose or rectal glucose. Yeah.
Rectal?
That's what it said. I even read it. No, I was It was on one of the tests.
So basically, glucose product they have.
Yeah, like you gotta call medical direction for permission, and that was one of the answers.
Okay.
It wasn't on any test I took.
On your rectal glucose.
Glucose product.
Did you read about that?
I haven't put any test yet. That's why I was wondering. No, it's again.
It had been 20 because it was in 20.
Is there such thing?
I've never given it that way.
I don't think it would work that way, would it?
I wouldn't give it that way.
So it go into the bloodstream?
Would you use a tongue depressor?
Yeah. I think so.
Okay, we gotta get it serious. Rob's getting aggravated. It's class.
I'm sorry.
Well, I'm not gonna aggravate it. Abdominal anatomy and physiology. Did we not? Hey, did we not already go over A and P of the abdomen? Thought we already did way back when. We talked about the 4 quadrants,
Kind of, sort of, but not.
and I told you to know what organs are in each quadrant.
They talked about hollow digestive organs,
Okay.
solid.
So, abdomen anatomy and physiology. Abdomen contains many organs from several different body systems. Can cause confusion when determining the cause of abdominal emergency. Thorough patient assessment is key, and then specific diagnosis may not be necessary. Treatment is the same for most conditions. There's a key right there for abdominal emergency. And that's even true for even at the paramedic level. There are a few that we get a little more excited about, possible ectopic pregnancy that's ruptured, so you have the blood pressure dropping and things like that. But for the most part, we're going to treat them. The treatment's all the same. So, abdomen region between diaphragm and pelvis contains many organs and organ systems that provide the following functions: digestive, reproductive, endocrine, and regulatory. All right, so over on, let's see, it'd be on, you guys looking at it, on the left side of the screen, you have the spleen, liver, pancreas, and kidneys are solid organs. You know what happens if, which organs, okay, so hollow organs are stomach, gallbladder, duodenum, large intestine, small intestine, and then bladder. Which organ do you think is more susceptible to blunt force trauma? So like let's say hitting a steering wheel.
Spleen or gallbladder.
Okay, maybe that's not the right question. Solid or hollow? Solid. Yeah, because it doesn't have any give, right? It hits and it tears or ruptures or whatever. But whereas a hollow organ has some give. Yeah. So abdomen divided into quadrants: right upper quadrant, left upper quadrant, right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. My goodness, I want to go home. Oh yeah, this thing. Epigastric, and then the epigastric region. So, epigastric region is kind of where the stomach and the esophagus are. So there's your diaphragm, umbilicus there in the middle. The belly button is what divides between the right and left, and the upper and lower. So belly button, jawline through it, both vertical and a horizontal line, and you have your 4 quadrants. Organs of the abdomen, peritoneum, thin membrane lining the abdominal cavity and covering each organ. Peritoneal, parietal peritoneum attached to the abdominal wall. Visceral peritoneum covers each organ. So you guys will probably want to remember the difference between the parietal peritoneum and the visceral. Organs of the abdomen, most enclosed within parietal peritoneum. A few lie in extraperitoneal space outside the peritoneum. Kidneys, pancreas, part of the aorta lie in the retroperitoneal space, so behind the peritoneum. And then bladder and part of the rectum lie inferior to the peritoneum. So the kidneys is the one that I always knew as being in the retroperitoneal space. But, I guess also the pancreas and part of the aorta. I didn't know that. I learned something new. I'm just kind of looking at this picture here.
I have a different view as I do.
Uh-oh. Abdominal pain or discomfort. I skipped in. Is that right? Okay. Visceral pain originates from the organs within the abdomen. We already kind of went over this, but frequently described as dull or achy. Colic, intermittent pain may result from distension and or contraction of hollow organs. Persistent or constant pain often originates from solid organs. So that's interesting. So intermittent pains from hollow organs. Persistent pain or constant pain is often originates from solid organs. I didn't know that either. I learned something new there.
Pain is dull and persistent. And solid.
Well, if it's persistent pain, that's in solid organs. And if it's colic,
Persistence means just.
yeah, constant pain.
I have to disagree with that.
Okay, why?
Because man, when it's that time of the month and you got the cramps, that's persistent.
Oh,
When it makes you-
that's not
when it makes
persistent.
you throw up every month, that's persistent.
But does it the whole time that you're on that time of the month, is that pain at that intensity that makes you throw up the entire time?
Yes.
It is not.
I bet you $10,000. I've been doing it since high school.
You are unique.
I mean, I'm not joking. I'm seriously, I am sick for the duration.
No, you never get any. It never lets up and comes back and contractions.
Oh, I can make it go away for the pain meds.
So
I mean, some high powered opiates. Yeah,
so that's where opiate problem starts from.
that's where it would start from with me.
So anyway, and I mean, I'm not trying to tell you that
No,
you're not
I'm
in
just
that
saying,
pain.
I don't believe it's always just a.
Well, and I don't
Everybody's
think
body's different.
it means that but this is a good guideline. If it's intermittent, it's probably a hollow organ. If it's a solid, constant pain, it's probably a solid organ. Solid.
One of those times you need someone to keep your bed to get better.
I feel better if I go by pressure.
Parietal pain originates from the parietal peritoneum. My goodness. Many nerve endings allow for specific, efficient sensation of pain. Frequently described as sharp, pain is often severe, constant, and localized to a specific area. That's parietal pain. Originates from parietal peritoneum. Tearing pain. So abdominal pain is most common type of abdominal pain. Or, most common type of abdominal. What?
It's not.
Tearing pain is not the most common type of abdominal pain.
Wow, that's amazing. I'm going to agree with that. It's not. I was kind of struggling with it.
Because it's the aorta of the stomach.
Yeah. So not the most common type of abdominal pain originates in the aorta. The aorta tell you something. Separation of layers of this large blood vessel caused by an aneurysm. Retroperitoneal location of aorta causes pain to refer to the back. Sometimes described as a sharp stabbing pain in the stomach, or sometimes they'll describe it as being in their back. So, if you've got a feel your abdomen, you feel a pulsating mass, they dry fast.
I don't know about that. My dad had one,
An aneurysm.
and he was at the VA, and his regular doctor didn't see him, a foot doctor saw him, and foot doctor's like, oh, your pulse is irregular, let's check into this. And that's how he found out he had one. Well, they let him loose, but it's like that. Well, then when we got him home, we're watching his stomach and bump, I think we need to have surgery on that thing, you know. And so they set him up like 2 weeks later.
What?
Yeah. He was going to go file his plan. The neighbors came over and does crop, you know, because that was his quarry, they got his crop in that year.
Wow.
They went back and he had a gigantic aorta aneurysm.
Various systems. Bad.
So
Yeah.
that's a very surprising story.
Yeah. But that was back in the 80s.
Yeah.
So they wouldn't do that now.
So, referred pain, perception of pain in skin or muscles at distant locations. Abdomen has many nerves from different parts of the nervous system. Nerve pathways overlap as they return to the spinal cord. Pain sensation is transmitted from one system to another. So there may be in your book. If not, you could find it. It's kind of a picture, or like it says, right shoulder pain is I don't even know what it is. Gallbladder. Okay. Is that picture in your book? Okay. They're out there somewhere. There's a pretty good picture of it. But we're just kind of list each one.
My gallbladder was nowhere near my shoulder.
It can. It doesn't have to. No, it can cause referred pain. Not always. So,
Right shoulder blade.
so
When mine went, but it was my initial cramp. Like some of the worst ones ever.
So appendicitis, infection of appendix, signs and symptoms: nausea and sometimes vomiting. Pain often initially referred to umbilical region, followed by persistent right lower quadrant pain. Ruptured appendix, sudden severe increase in pain, constant releasing into the abdomen causes severe peritonitis. All these words that I don't even know how to say.
Because it's the most common cause of the person using the surgery.
My grandma went through her appendix rupture. She didn't even know it ruptured. And she went and had a hysterectomy years and years and years and years later. But somehow the poison, or whatever you call it, was contained in a large mass. Wasn't cancer, it was some kind of something contained. Things like they don't even know how long it's been ruptured.
Peritonitis, irritation of the peritoneum, usually caused by foreign material in peritoneal space. Parietal peritoneum is sensitive, especially to acidic substances. Irritation causes involuntary contractions of abdominal muscles. Signs and symptoms: abdominal pain and rigidity. Inflammation of the gallbladder, so cholecystitis and gallstones. Inflammation of the gallbladder, often caused by blockage of its outlet by gallstones. Oh man, yeah, whatever. Cholecystolithosis. Yeah, I'm going to be saying that word a lot. I'll just say gallstone. Symptoms often worsened by ingestion of fatty foods. So you get that person who has that abdominal pain that, that's usually holding it down here. They might think it's a cardiac event, but they ask, well, what did you have to eat today? Well, I had 16 pieces of pepperoni pizza. What? Cause for pain. Signs and symptoms: severe right upper quadrant or epigastric pain. Pain often referred to shoulder. Oh my gosh, I'm having a heart attack. It's going to my shoulder.
Yes, it's all right there.
My shoulders do hurt.
The pancreatitis, inflammation of the pancreas, common in patients with chronic alcohol abuse. Signs and symptoms: epigastric pain, often referred to back and or shoulder. GI bleeding. These are fun. No, not really. Hemorrhage within the lumen of the GI tract may be minor to severe. Blood habitually exits mouth or rectum. Often painless. Gastric ulcers, holes in GI system from highly acidic gastric juices can cause severe pain and peritonitis. GI bleed stink. Well, the coffee grounds stink. If it's bright red, it doesn't want to stink. Signs and symptoms: dark colored stool, maroon to black, often tarry. Frank blood from rectum, typically a hemorrhoid. Vomiting coffee ground appearing blood. Vomiting of frank blood, and pain can be absent to severe. So typically if you're talking about vomiting frank blood, you're talking about the stomach, so sometimes esophageal varices, something there, the blood hasn't started to break down yet. A coffee ground appearance, vomiting coffee ground appearance of blood. Now the bleeding somewhere in the stomach, so it's going down into the stomach. So you can't have a mixture of frank blood and the coffee ground. Frank is bright red. It's yeah. What'd you say?
No, it's just like one.
It does, yeah. Frank blood is just regular looking blood. Frank's blood.
I just wonder what Frank meant. I didn't know what it meant.
If it's the coffee grounds, it's typically been in the stomach, so it's been digested, and that's why it's that coffee ground, that black tarry coming out of the rectum. You know that it's been through that digestion process, so it's not in the lower rectum, like maybe like I said, hemorrhoid.
It's totally different. I had it up, I took it down, and when the stuff came in, I pulled it and said, "What's this?" And just like, holy crap! All this coffee ground and crap came in there. Oh my God, what have we done?
Yeah. This guy's bleeding. Abdominal aortic aneurysm, ballooning or weakening of inner wall of the aorta, tears and separates from outer layers, dissection. Weakened vessels, bulges, may continue to grow, may eventually rupture. They don't always rupture like Ellen just told us, but they have a high chance of rupturing. And I think it was told to me at one time, anything greater than 7 millimeters has a pretty good chance of rupturing. And the thing about it is, if that bulge ruptures, if it goes ahead and it ruptures, then you you will die. There's no saving it. So, there's very little chance. I should say there's very little chance to save it.
He had no pain or anything.
Really, that's amazing.
He was one of those old World War II vets, so he didn't have.
You didn't know what pain was.
His brother was so-
Even if he did have pain, he wasn't going to tell you. I don't want to be beat anymore. So abdominal aortic aneurysm, signs and symptoms: progressive, often sharp or tearing. Abdominal pain frequently radiates to back, lumbar. Palpable abdominal mass, possibly pulsating. Possible inequality in fetal pulses. Ellen kind of told us about that in the feet. Sudden severe increase in pain may indicate rupture. High aortic pressure causes rapid internal bleeding. Sudden progression of shock, likely exsanguation. So exsanguation is fatal hemorrhage. You basically bleed out your stomach. So if you have a patient that you suspect has an abdominal aneurysm and they tell you they need to go, they feel like they need to have a bowel movement, don't let them. Tell them no, we need to go. Hernia, hole in the mucosal, hole in the muscle layer of abdominal wall, allowing tissue or part of organs, commonly intestines, to protrude up against the skin. May be precipitated by heavy lifting, may cause strangulation of tissue or bowel obstruction, may require surgical care. Signs and symptoms: sudden onset of abdominal pain, often following exertion, palpable mass or lump on abdominal wall or crease of groin, so you have an inguinal hernia. Renal colic. How many more pages we got? Okay. Renal colic, severe flank pain caused by kidney stones traveling down the ureter. Signs and symptoms: severe cramping, intermittent pain in flank or back, frequently referred to groin, nausea and vomiting. Cardiac involvement. Hey, that's a big one, right? Pain from myocardial infarction may be felt as abdominal discomfort, epigastric pain, indigestion or digestive comfort. Always consider the possibility of a cardiac emergency as a cause of abdominal symptoms. All right, unless you can just pinpoint it, you want to at least consider it. Here's we're not going to watch that video. I already tried to play it. Assessment and care of abdominal pain discomfort. Many potential causes of abdominal pain. Role of EMT is not to diagnose. Focus efforts, perform thorough secondary assessment, and identify serious life-threatening conditions. Protect yourself from bloodborne pathogens. Be aware of odors and determine if the patient's condition is medical trauma or both. So, primary assessment, general impression, ABCs. So, kind of going through that checklist that you guys have, that National Register checklist that you guys should be studying on your when you're not studying this other information. Yeah, my Ninja Star went away. So we start with general impression, ABCs, level of consciousness. Consider application of supplemental oxygen to any hypoxic, abdominal pain patient, or in any situation where an oxygen saturation is deemed to be inaccurate. Onset. When did it begin? What were you doing? Provocation. What makes it better or worse? Movement, position, quality. Describe the sensation in your abdomen. Region, radiation, points of location. Does it radiate or move? Severity. How bad is the pain on a scale of 1 to 10? Time. Do you have pain all the time? Is it intermittent? Has it changed? Yay. So, that's what that was. Good job, Ellen. Everybody else recognize that? Yeah. Where are you in your history specific to female patients? Emilio, you need to pay attention here because this is where everybody fails. So, where are you in your menstrual cycle? Is your period late?
Okay.
I think you say okay.
Yeah, I asked my wife.
So, do you have bleeding from the vagina that is not menstrual blood, or menstrual? Is your flow normal? Have you had this pain before? If so, when did it happen? What was it like? Is it possible you're pregnant? Are you using birth control? Is it possible you're pregnant? I think I've already told you guys, but if it's maybe a teenage girl that doesn't want her mom to know that it is possible, she's not going to answer that in front of her mom. So you might ask her again whenever you're away from the mom. All right. Hey, look, here's ample. So all we need is signs and symptoms, and then allergies, medications, pertinent past history, last oral intake, and events leading to emergency. Geriatric note. Decreased ability to perceive pain, especially whenever they're World War II vet. More serious cause of abdominal pain, more likely to be life-threatening, and may be complicated by medication. So, you guys have an idea why it might be more life-threatening?
Because they want to tell.
Well, and you also have that more serious, decreased ability to perceive pain. But sometimes these problems go on longer than they should, and so now they're worse than they need to be. So they just really didn't realize it. Physical examination of abdomen, inspection, distension, discoloration, and then protrusion, palpation, use fingertips, painful area last. I already told you guys, palpate the painful area last, right? So, on palpation, you're looking for rigidity, pain, or guarding. You guys know what guarding is? Pretty obvious. It's kind of, they tense up. Feels like rigidity, but rigidity is even when they're not tense. It's hard. A lot of times it's from like a bleed or something in the abdomen. Yeah. And then pain, that's obvious. Baseline, then every 5 minutes for this patient. Know that for text, but knows that's not feasible. The pulse, respirations, blood pressure, skin color, temperature, condition, pulse oximetry, and mental status. General abdominal distress. Some will result from digestive system disorders. Others could be cardiac or diabetic issues, food poisoning, or flu. Assess and care for these patients with appropriate attention to airway, particularly if patients vomiting. Always work to calm the patient to reduce anxiety. Never give patient anything by mouth. So, they may have to have surgery. You're right. And anesthesia don't like them to have things by mouth. So, maintain airway. Be prepared for suction. Administer oxygen to hypoxic patient. Maintain oxygen saturation of 94%. Place in position of comfort. Left lateral recumbent for airway protection, and then transport to appropriate facilities. So a lot of these are basically the same, right? Maintain airway, be prepared for suction, and administer oxygen to maintain 94%. And that's like on every patient. So think about it. An 89-year-old female with a history of diabetes, hypertension, and gallstones is complaining of nausea and dizziness about 20 minutes after ED. So where do you guys want to go with this patient? What do you think? Do it.
We have also, she's diabetic, complaining 20 minutes after eating.
Something. Does it really matter?
No,
So what are the concerns with this patient? Obviously the dizziness, right? Is this an abdominal emergency, a diabetic emergency, or a cardiac emergency? It could be all the above.
we do not diagnose on the patient.
Dizziness is gonna be coming from the sugar.
It could be all the above, but if you're alert and oriented and dizziness and nausea, you already ate, definitely check the sugar. I would on this patient, you have some history there of abdominal pain, but with the dizziness and stuff, I'd have to be convinced it wasn't cardiac. So then
But if you come upon something like that, you're gonna take everything anyway.
you are ish.
When you're hurting guy enough,
You could. If you have gallstones and gallbladder problems, that makes you nauseated, and that pain and discomfort can make you dizzy. Definitely. How will you know?
Treat it as a life-threatening and check everything.
How will you know? You won't. Yeah, thank you. What will the treatment be? I would load up. Load up. Do your ABCs and go through your thing. Maintain an O2 set at 94%. Be ready to hit the suction. I would see if there's any reason that we don't want to give her aspirin. I might even consider aspirin and O2 to keep at least 94%. Chapter review. All complaints of abdominal pain or distress must be treated as serious emergencies requiring transport. As an EMT, responsibility is primary to assess the patient and report your findings. Field diagnosing the cause of abdominal complaint is often more difficult and time-consuming than diagnosing in the emergency department, where there are many more resources available than in the field. Your assessment should include thorough patient history, physical exam, and vital signs. Easy enough, right? Look for signs and symptoms that can signal serious trouble. This includes the sudden onset of tearing pain radiating to the back, which is a sign of aneurysm, vomiting, blood or coffee grounds like material, which is a sign of GI bleed. The presence of black tarry stools, which is also a sign of or signs and symptoms of shock, which is a sign of shock. Yeah, you were exactly right. All the above. It is signs and symptoms of shock are just that, signs and symptoms of shock, and could be from hypovolemia, but we're going to treat for shock, right? Emergency care will consist of protecting the patient's airway, oxygen as needed, placing the responsive patient in a position of comfort, placing the unresponsive patient or patient with difficulty maintaining airway in the left lateral recumbent position, and transporting the patient to the hospital. Don't lay him on their back. Okay, go ahead.
Why left?
Why left? Because, so on the ambulance, go lay on your right side.
That's up.
You're facing the wall.
Lay on your right side. Where's that one table there?
You can't do it. But the other thing, I think that it's easier to clear that airway. I think there's something about the anatomy of it, how your stomach lies and everything like that. It's easier to secure the airway if you're on your left side. Yeah, that is to reduce the pressure on the aorta, I think.
Growing up, when I have really bad spells at night, the only way I could sleep was propped up on my left side. I have 4 pillows over my head, and I still don't have my elbow.
Take all appropriate standard precautions and carefully clean and disinfect equipment in the ambulance, especially if the patient has vomited or had diarrhea. Remember, abdominal organs provide a variety of important functions to the body. The abdomen can be divided into 4 quadrants with a reference to the midline and umbilicus. Classification of pain can help identify specific abdominal dysfunction. Assessment and management always take a higher priority than determining the exact cause of the abdominal pain. Knowledge of the characteristics of specific abdominal disorders can aid in differential diagnosis when assessing a patient with abdominal pain. Care for a patient with abdominal pain should include treatment of immediate life threats, administration of oxygen, placing the patient in a position of comfort, and appropriate transport. Questions to consider. What are 5 signs and symptoms of abdominal distress?
Yeah, but I haven't.
You said 2. Nausea. How about a pulsating mass? There we go. That's fine. Describe the difference between visceral and parietal pain. Describe a condition that may be responsible for each.
this row is the crazy, dull, and stuff. It's not, and the shadow is where it's localized pain, the real skin tone.
Study that, EMT students.
We haven't looked
Was
at
that
close?
Sure.
Okay.
So, what is the emergency care for patients experiencing abdominal pain or distress? Name the 4 abdominal quadrants.
Left upper quadrant.
How are the quadrants determined?
By the middle of it.
Midline and belly button. Yeah.
They said that we were here.
I know. So I don't know why we're doing it. So you were called to a patient with abdominal pain. He describes the pain as severe, and says it has been an on-off over the past several days, becoming severe within the last hour. What additional questions would you like to ask the patient? Exactly. My question is the intermittent pain, which would we be considering this, a hollow or solid organ?
Right.
So it'd be a hollow organ, right? Yeah. All right. Okay, done. I'm going home. I'm
Which
tired.
position are you most comfortable in, the fetal position?
Sometimes